Now let's go to the additional terms related to the system. Menstruation or menses. It is a cyclic shedding of endometrial lining and discharge of bloody fluid from the uterus. Occurs approximately every 28 days. Ovulation. It is a process of discharging one ovum from an ovary. Conception or fertilization. It is instant, at which the spermatozoa and an egg unite. Human chorionic gonadotrophin. It is a hormone secreted by the fertilized ovum soon after conception. Gestation or pregnancy is the state of a female after conception and until delivery. Gestational diabetes is diabetes that develops or first occurs during pregnancy. Eclampsia, seizures or coma in a patient with pregnancy-induced hypertension. Braxton Hicks contraction. It is painless uterine contractions that happen throughout pregnancy. It can be also called false labor. Effacement, thinning of the cervix in preparation for delivery. Postpartum depression. It is a form of clinical depression that occurs soon after giving birth. Lochia. It is discharges from the vagina of mucus, blood, and tissue debris following childbirth. Amniotic fluid is fluid that encases the fetus and provides a cushion for the fetus as the mother moves. Umbilical cord. It is cord composed of blood cells and connective tissue that is connected to the fetus from the placenta. Abruptio placentae. It is placenta separated from the wall of the uterus prior to the birth of the baby, which can result in severe, uncontrollable bleeding. Oligohydramnios, a presence of insufficient amount of amniotic fluid. Placenta previa. It is condition in which the placenta is implanted in the lower segment of the uterus instead of the upper part. Prolapsed cord. It is the slipping of the umbilical cord into the vagina before delivery. Nuchal cord. Loops of umbilical cord around the neck of the fetus, posing risk of intrauterine hypoxia, fetal distress, or death. Breech pregnancy. It is a pregnancy in which the buttocks of the baby present first. Premature birth or premature delivery. It is a childbirth that occurs between the date of the fetal viability and the end of the 37th week of gestation. Ventricular septal defect. It is failure of an opening or foramen to close between the ventricles after birth. Cleft lip, a congenital facial defect of the lip. Cleft palate, a congenital fissure in the median line of the palate, often associated with cleft lip.
Down syndrome. It is a congenital chromosomal condition characterized by mental retardation, retarded growth, and various other physical abnormalities.
Ectopic pregnancy. It is a pregnancy that occurs when the egg implants itself outside the uterus.
Uterine prolapse. Protrusion of the uterus into or through the vagina.
Bacterial vaginosis. It is a bacterial infection of the vagina. Cervical dysplasia. It is growth of abnormal cells on the surface of the cervix. Pelvic inflammatory disease, or PID. It is inflammation of the female pelvic organs, such as ovaries, salpinges, and the uterus. Polycystic ovary syndrome. It is a hormone disorder in women, characterized by irregular menstrual periods, excess hair growth, obesity, and numerous other symptoms.
Sexually transmitted disease, or STD. A communicable disease spread from one person to another, primarily through sexual contact.
Now, it's time for a legend related to the system. In Greek mythology, the Sirens were sea creatures that were part woman and part bird, or part woman and part fish, whose beautiful singing made sailors sail towards them into rocks or dangerous waters. In Homer's Odyssey, Odysseus was curious about what the Sirens sent to him, so he ordered all his sailors pluck their ears with beeswax and had it for them. He also asked his men to leave him tied tightly to the mast, no matter how much he would beg. As expected, when he heard the Sirens' beautiful song, he began to beg his sailors to untie him, but luckily, they bound him tighter. Ceremonia, alternatively known as Mermaid syndrome, is a rare congenital deformity in which the legs are fused together, giving them the appearance of a mermaid's tail, as the nickname suggests. This condition is found in approximately 1 out of every 100,000 live births and is usually fatal within a day or two of birth. Only a few individuals are known to have survived beyond birth with this condition.